Hello everyone and welcome to another day of high yield USMLE questions. Today we will be talking about cardiology. So we have a 65-year-old male patient presented with acute chest pain radiating to the left arm. ECG shows ST elevation in the anterior wall of the left ventricle. The patient was treated for myocardial infarction and was prescribed appropriate medication. Few years later, he came to the office. His wife says he did not take the medication prescribed at discharge. Echo shows ballooning of the left ventricle. A medication with which of the following mechanism of action would have prevented this echo finding? So remember, first of all, so this patient is having remodeling of the left ventricle. Remember, so when any, for example, anterior wall MI or any myocardial infarction occur, the patients are at risk of cardiac remodeling, these are just a set of changes in the ventricle structure that results in poor prognosis of the patient. They can result in myocardial dysfunction. They can also result in arrhythmias as well. So there are a few medications that can prevent this remodeling. One of them is ACE inhibitor. So this would be the answer here. So the answer here would be, so ACE inhibitor. There are other medications like spironolactone, which is a aldosterone antagonist, can also help with this. Also SGLT2 inhibitors can help. Beta blockers like carvedilol can help with preventing this myocardial remodeling. And so remember, these medications act locally to prevent this, because so let's say someone has an MI, then let's say that patient does not take ACE inhibitors. So if there is no ACE inhibitors, what will be the fate? Remember, particularly if it's anterior wall MI. So anterior wall MI, remember, any MI, but particularly anterior wall MI, you absolutely need to give ACE inhibitors. So let's say this patient does not take ACE inhibitors, so their heart will be like balloon shaped. I exaggerated it just to kind of reiterate this point. So exaggerated this diagram. This is like ballooning or thinning of the wall. So that can eventually cause like myocardial dysfunction, or heart failure can occur. Also, as it can affect this myocardium, it has the electrical pathways, so it can cause arrhythmias as well, and eventually death. So then we have let's say someone who took ACE inhibitor. So their myocardium will be protected. There will be just a scar, the old scar, and that's it. And their myocardium will be protected. So this is, remember, this remodeling takes about weeks to months to occur. So important information. Remember, if someone has any myocardial infarction, you should start ACE inhibitor. If the ejection fraction is less than 40%, you should start ACE inhibitor. Ejection fraction is less than 40%, you should also start spironolactone. Some books say if it is less than 35%, then you should start spironolactone. SGLT2 inhibitors can also help. Carvedilol, metoprolol, cardioselective beta blockers can also help with preventing this remodeling and decreasing mortality. So let's quickly go through the other options here. So this is the right option. Then COX inhibitor. COX inhibitor is the wrong answer. Most likely here they are talking about aspirin. Remember, aspirin is given after MI, but it does not prevent the cardiac remodeling. P2Y12 inhibitor, wrong answer. This is most likely they're talking about clopidogrel. Wrong answer. It is given in MI for the first year, but it does not prevent cardiac remodeling. As sodium potassium trichloride transporter inhibitor, this is talking about furosemide. This is also a wrong answer, because this is furosemide, which is a diuretic. It can help with symptoms of heart failure, and also reduce number of hospitalization, but it does not help with decreasing the risk of cardiac remodeling and mortality. So for mortality, remember, spironolactone, ACE inhibitors, SGLT2 inhibitors, also cardioselective beta blockers like metoprolol and carvedilol. So these will be the main go-to drugs to prevent cardiac remodeling and decrease mortality. So if anyone, hope you like this video, and if anyone requires tutoring, they can email me here. Also, you can email me if you want to enroll in my biostats class and CCS classes. And if you like the channel, you can support me at here, link in the description.